Hello guys, hope you are all okay. I'm Dr. Shanadeem Awan with my radiology and ultrasound teaching video. Hope you are doing well. Today the topic of discussion is calcaneal fracture, and a particular anterior aspect of the calcaneal fracture is sustentaculum tali. Sustentaculum tali is a fracture of the calcaneum, and it's quite common during the sports injury, during the road traffic accident, and sometime after the fight you may have sustentaculum tali fracture. Normal radiograph, like conventional radiograph, cannot easily pick this sustentaculum fracture, but on the CT images you can quite confidently pick these findings. In the next video I have discussed about the sustentaculum fracture, sustentaculum tali fracture, along with its types and its further characteristic and classifications. So let's watch this next video. Axial CT images, you will see calcaneal fracture. So let's start step by step. Look into the anatomy here in view. You will be able to see the tibia and the fibula. Here the tibia and fibula is visible, and if we progress forward, so you will be able to see that in view there is medial malleolus and the lateral malleolus. If we progress forward, so I will bring in view the entire calcaneum. So it's the calcaneum. If you look to the calcaneum from the down, this is the posterior part of the calcaneum, and then there is a middle part of the calcaneum, and then there is anterior part of the calcaneum. The posterior part, this posterior part is called as calcaneal tuberosity. So then the middle body, and I am progressing forward to the anterior margin. Here now I am at the anterior margin of the calcaneum. If you look towards the medial aspect, on the medial aspect, this particular anatomical structure is called as sustentaculum tali. So here you can see sustentaculum tali, here the fracture lies. So now focus on the fracture now. It is towards the medial side. On the medial aspect, you can see this sustentaculum tali is separated from the main body. So the first thing is that there is separated fragment. The second thing is this fracture is oblique in nature. The third point is this is extra articular, it is not intra articular. And the fourth point is it is detached. So these are the four characteristics of the fracture. If you look in detail, so you will be able to classify the calcaneal fracture into extra articular or intra articular. So look at, this is not the intra articular, this is extra articular. And the second thing, you may also classify this calcaneal fracture into type A, which is anterior aspect, type B, the middle. So far this sustentaculum tali fracture is concerned, it comes into B category, and type C is the posterior tuberosity. If there would have any fracture of the posterior tuberosity, you would have to label it as N type C, but this is sustentaculum tali fracture, which is considered to be extra articular, which is in fact extra articular, and it is type B. If you progress forward, so in view you will be able to see further bony structure, and these bony structures are talar bones. So this is what the talar bone is, and on the top in anterior aspect you can see the navicular bone. I am progressing forward, so here you will be able to see the talar bone, the navicular bone, and cuneiform bone. Mind you that cuneiform bone has three parts: the lateral cuneiform, the intermedialis, and the posterior or the medial cuneiform. So lateral cuneiform and the medial cuneiform and the intermedialis cuneiform. So here just I am bringing you back to the calcaneal fracture. Here this is extra articular fracture, this is type B fracture, this is sustentaculum tali fracture, this is oblique, separated fragment, and detached fragment. So this is what we call is sustentaculum tali fracture of the calcaneal bone.